Well, hello everyone, and welcome to another Focus podcast. I am Singinlisa, your host. So excited to be back with you. And as we mentioned on a previous episode, we are focusing on who we want to call heroes. And these people are heroes because they have survived COVID-19. So I think it's a well-deserved honor. And you are looking at another survivor of COVID-19, a hero in our eyes, and he is Dr. Robert J. CHUGDEN. He is the Chief Medical Officer at West Jefferson Medical Center and on the West Bank of Louisiana, and we're just excited to be able to share with him and to hear his story and his journey. So, Doctor, so good to be able to speak with you, and thank you for taking some time out of your schedule. How are you today?
I am 100,000% better and feeling generally pretty good.
Yes. Well, to be able to say that means you've been through some things that I know many of us don't have firsthand experience at. So please share with us, where were you when, let's say, when COVID-19 started? Because you're a doctor, you're already on
Yes,
the front lines
yes.
giving care and providing service for other people. So what was going on when you first started hearing the news of COVID-19?
Well, I think we first heard the news when everyone else did, when there was reports of a certain odd virus in China, and we hoped that it wouldn't spread here, but unfortunately it did. As soon as it did, since I'm the chief medical officer, I and the rest of the leaders in the hospital decided we had to start preparing for it. So we started preparing in efforts to get the proper amounts of protective gear and to make sure we had room and ventilators to care for the patients that might come our way. Of course, we had heard of the experiences in Seattle and then in New York, New Jersey area, since they kind of had most of these cases first. And to be honest, it was quite frightening. It sounded like a real devastating disease, and we knew that we would have to strain pretty much all of our resources to try to deal with it. But we did, and so most of our time was spent, again, trying to make sure that we had the proper protective equipment for our employees, to make sure that we had the proper rooms and areas in the hospital that we could treat these expected patients, and especially to separate them from other patients. So that's what most of the effort was around. One of the things we did very early, in fact, I believe we may have been the first in the state, was to open up a drive-through COVID testing unit in some tents outside of our emergency room doors. And that was very successful. We had big crowds from almost day one. And we proceeded like that for a while until we actually started to get overwhelmed. And at one point, I think we had over 130 COVID patients in the hospital, and all of our ICUs, we have three of them, were full. And we had actually opened another area that, ironically, way back during the Ebola scare, we had opened a unit to care for Ebola patients. And we didn't have any Ebola patients, but we still had the unit. It was not staffed and was kind of just sitting off to the side. And we decided that we would repurpose that as a critical care area for COVID patients if we needed it. And it turned out we did.
Wow.
So, this went on for several weeks. And part of when it got really bad at the hospital, where it was very stressful for our staff, they had to go in and out of cohorted units, almost through an airlock type situation where it's double doors, and take off and put on protective gear from head to toe every time they left the area, and then put it back on when they went back in. So it was very stressful for the staff to have to do all this and take all these extra precautions. Of course, we followed the state issued guidelines and limited visitors, which was again stressful on our patients as well as our staff, because our staff doesn't like to see their patients left alone by their loved ones. And so we instituted a program fairly early on using iPads and one of the telecommunications apps, so that families could kind of virtually visit their loved ones by means of an iPad video conference situation. And so we pass those out to all the units. We also use those for physicians to be able to see patients who didn't actually need the kind of hands-on touch at that moment, and that prevented the physicians from having to use the protective gear to go in and come just to see one patient and come out, because that was in fairly short supply. We never ran out. We always managed to find the supplies we needed. We did make efforts to re-sterilize or reuse a lot of the personal protective gear, particularly when we were what we call cohorting patients. In other words, we'd have an entire wing that would just be COVID-19 patients. So once you put on your gear, you didn't have to worry about infecting another patient because they were all infected anyway. Right. So you could use the gear and wear it for long periods as long as you stayed in that unit. We were doing all that, and this, again, as I said, was very stressful. So my job at the time was really focused on keeping up the morale of our nurses and doctors and therapists and what have you. And so I would go from unit to unit and try to make sure they had everything they needed. And if there were any problems, please let me know, and I could, work through the executive kind of hierarchy to get what was needed, whether it be testing or supplies or just food for a break. Yes. And again, the iPads, that was another one of my tasks, was to go make sure everybody had adequate iPads and knew how to use them, and to use this sort of televisitation and telemedicine kind of approach. So I was doing this, and we were working 7 days a week, fairly long hours. And I thought things were going pretty successfully until one day I started feeling sick. So I didn't have a cough or a fever or anything like that. I just felt a lack of energy. And I thought, oh my goodness, I wonder if I'm coming down with this COVID-19 thing. And this was in April. And I went to get myself tested. Well, at the time, we had the standard test, which many of you may recall was taking 10 days to get results sometimes. But we had just gotten a new test in the hospital, and it promised results in a few hours. So I thought, great. So I went in to get the test, and the nurse that was running that testing site said, well, since we have this new test, we're not really sure how well it works. Just to be sure, let's do the old one, excuse me, and the new one. So I said, okay, great. And so they did the old test, which involves sticking a probe through your nose, seemingly to the back of your brain, but a very long way. And then the new test, which the probe didn't have to go so far. And so I went back to await my results. Well, a few hours later, I was called and said, the test is negative. Wow. So I thought, okay, well, I guess I just feel tired from working 7 days a week and long hours. I'll go back to work. So I went back to work and, continued what I was doing. But I just didn't feel well. I started to have these kind of earaches. But again, no fever, no cough or congestion or anything of the sort. And, but I didn't feel well. So I said, well, I think I'm going to go home early today. I just don't feel well. So I went home, and I was scheduled to be back the next day, which was Saturday, to work in the command center. In other words, we had 2 people assigned during the weekends, every weekend day, to kind of be in charge. So I was going to be one of them on that weekend, myself and one of the vice presidents. And so Saturday came, and the vice president called me while I was still at home and said, don't come in. And I said, why not? And she said, because we just got your test result back, the one that took several days. Okay. And it only took 3 days, fortunately. And it's positive. And I said, oh my goodness, the other one was negative. So I've been here for 2 more days, and I was positive, because they were both taken at the same time. Yes. So she said, yes, you have, but don't come back. Whatever you do, don't come back. I said, all right, fine. So I stayed home thinking, well, I'm a healthy person. I'm not, a spring chicken anymore. I'm not a young person, but I'm healthy. I don't have any medical problems. I don't take any medicine. Certainly don't have breathing problems. I never smoked. This should be fine. I'll just have a flu-like syndrome. And so I stayed home. And day or two later, Sunday, I think, I started developing just tremendous joint pains, just tremendous joint pains. I felt like my joints were welded solid, and I couldn't move without breaking something.
Wow.
But I still didn't have a fever until that night. Then I developed a fever, and so I just had these aches and pains and fever that seemed to go away with Tylenol up until Wednesday, and then I woke up and I couldn't breathe.
Oh.
I just couldn't breathe. So I called one of my doctor friends, a pulmonologist, and said, I can't breathe. What should I do?
Right.
And he said, well, that's a dumb question. If you can't breathe, you need to come into the hospital. So I came into the hospital, and my oxygen levels were very, very low. I was just as weak as could be, and my heart rate was 162.
Wow.
So I went in the emergency room. I had atrial fibrillation. My oxygen saturation was in the 70-something% range. And so they decided that they did all the routine tests, and they decided that they would admit me to the hospital, to the coronary critical care unit. At that point, all of our critical care units were taking care of COVID patients anyway, so we didn't quite honestly distinguish between coronary critical care and regular critical care or surgical critical care. But since I had atrial fibrillation with a very fast rate, they thought the coronary unit might be better because the nurses are used to it. So I was on various medications and drips, and they put me in there, and the heart rate got better, but the breathing kept getting worse and worse and worse. And I remember thinking, well, I'm not getting worse. I'm kind of the same, until one of the doctors came in and said, you may feel the same, but we're going up on your oxygen every few hours. Wow. So I think I started out at 3 or 4 liters per minute oxygen flow, and I was now at 17. So they said, so we're going up higher and higher and higher just to keep you kind of feeling the same. And so I said, well, that's not good.
Right.
That's not, but surely I can't be one of these people that are going to wind up on a ventilator or dying or something like that. And so a couple of days went by, and they kept increasing the oxygen, and I really didn't get any better, and was getting worse, in fact. So we had heard, this was a time when we were still hearing about how to treat COVID-19. And remdesivir had just kind of was on the scene, but it was investigational, and you had to apply to the Gilead Pharmaceuticals, I think, to be given a dose. So I'll back up a second. One of the advantages I had over your average everyday patient is, since I was a physician, the physicians discussed treatment alternatives with me in way more depth than they probably did the average person. So we decided, remdesivir might be a good idea, but we had heard of a very successful treatment of a patient at one of our local hospitals with convalescent serum. So in other words, it was a plasma transfusion, essentially, from someone who had recovered to someone who was very sick. And he had done very well. The man had done very well. So we called the local hospital and said, hey, how could we do that?
Right.
And they actually had someone there who actually was another physician who had recovered and agreed to donate his plasma. Okay. So he did, and I received it, and I got better fairly soon afterwards.
Okay.
For about 6 hours.
Really?
Yes. And then I started getting worse again, deteriorating.
Mm-hmm.
And so this went on. I was deteriorating more and more, and was getting to the point where they were talking about maybe needing a ventilator. And we decided, no, we're going to go with this external BiPAP thing first. And so we did that, and that helped for a little while. But then again, they came in and said, you're not doing too well. And I said, what do you mean I'm
My
doing fine? They
goodness.
said, well, you're doing fine because we keep increasing the pressure and increasing
Mm-hmm.
the oxygen flow, and now we're at the maximum. And they said, we're going to have to put you on a ventilator. And I said, no, I don't want to be on a ventilator. Just strap that mask on as tight as you can get it
Mm-hmm.
and crank the pressure up as high as you can, and I'll tolerate it. Well, I didn't know what I was talking about at the time, because that it really is painful to have the mask
Mm-hmm.
strapped that tightly to your face,
Okay.
because the higher the pressure of the oxygen they're delivering, the tighter the mask has to be to create a seal.
Mm-hmm.
So it really requires some tolerance, and it's painful across the bridge of your nose.
Wow.
And it also requires you have to kind of coordinate your breathing
With it.
with it. Otherwise, it blows your cheeks up like Dizzy Gillespie. For anybody who remembers Dizzy Gillespie, was a trumpeter, and his
Yes.
cheeks would get huge when he blew a trumpet.
Mm-hmm.
Anyway, um, so we did that, and one of my doctors arranged for another plasma transfusion under a program that the Mayo Clinic was running in
Mm-hmm.
Rochester, Minnesota. And so we got another dose of plasma, another unit of plasma, and I received that. And again, I got better, but this time I continued to get better. So I don't know if that was second time's a charm, or if it was plasma that had more antibodies.
Mm-hmm.
I don't know, or
Mm-hmm.
sometimes it just takes 2 or 3, I'm told. But anyway, I managed to improve and continue to improve, and my oxygen needs decreased. I was still COVID positive, though.
Mm-hmm.
They had run a test after I had recovered pretty significantly. I was
Mm-hmm.
still on oxygen, and it was still positive.
Now, at this point, were you still in the hospital?
I was still in the hospital. Yeah, I was still in the critical care unit.
Okay.
And so the decision, well, at this point, I probably didn't need critical care anymore, and they were going to send me to a room, a
Mm-hmm.
floor. And I basically said, look, my wife's a nurse. I can take care of myself at home. If I don't need critical care, couldn't I just go home?
Mm-hmm.
And so we had to kind of they had to kind of walk me around the lobby, well, not the lobby, but the nurses area in critical care, wheeling my oxygen tank and checking my oxygen saturation to see if it was adequate enough to go home.
Mm-hmm.
And they determined that it was. And so after about 2 weeks, I was discharged home with home oxygen.
Okay.
And so I've been there. Well, I was home pretty much the entire month of May, June, up until just now at the beginning of July.
Mm-hmm.
The funny thing to me is that I experienced almost no improvement in my breathing or my ability to do any activity for almost the whole 2 months, probably about 6.5 weeks.
So your
And
energy was
then
just
it was
depleted.
totally depleted.
Wow.
And if you were to ask me on June 10th if I felt better than I did when I was discharged from the hospital, I would have told you, no, I feel exactly the same.
Mm-hmm.
And I was concerned. I was afraid that I wasn't going to get any better, that there was permanent damage to my lungs, and that this was it.
Mm-hmm.
And I'd forever be bound to an oxygen tank, and not be able to do any physical activity. I mean, taking a shower was just exhausting, and I'd get short of breath and such, much less walking anywhere. I once tried to walk to the mailbox to get the mail, and came back and I almost blacked out before I got to my door.
Wow.
And that actually triggered another episode of atrial fibrillation, which I had to get converted again. And so I didn't really feel like there was any progress made at all until really about a week and a half to maybe 2 weeks ago. And then I started getting better noticeably day by day by day. In fact, one time in the middle of this, I went back to the hospital for a visit to my pulmonologist who had treated me in the hospital. And he got another chest x-ray and a CAT scan of my chest because it looked horrendous. I mean, I look at x-rays, so it's hard to explain to someone who doesn't, but there's an appearance that certain x-rays have that you see with chronic scarring, like people who have had terrible cancers or tuberculosis or
who were
are
smoking.
smoking forever, just
Yes.
heavy smoker. But they develop this pattern in their lungs that looks like a lot of scar tissue, and it never gets better. It just is what it is, and that's what it looked like. And so we did a CAT scan, which showed, it's probably not scar tissue. It's probably just this swelling, and maybe that'll go away. And so, fortunately, it did.
Yes.
And so I was very grateful for that. But for the
Shocking.
longest time, I thought, oh my God, this is it.
Yes.
I'm going to be a pulmonary cripple for the rest of my life, and there's nothing else I could do about it. So it was. I looked at it, the whole experience. I looked at both from the viewpoint of a patient and a physician.
Yes.
So on the one hand, I was a patient and I was afraid like anyone else would be. I mean, when they said they wanted to put me on a ventilator, I knew that at that time, up to 65% of people who get put on a ventilator were going to die.
Yes.
And I knew that when they put me on a ventilator, they would essentially anesthetize me. They'd put you on this drip where you're totally unconscious. And so I knew that moment, that might be my last moment on earth. Just the moment where I made that decision, I'll go on a ventilator, I may never wake up and I wouldn't even know it.
Yes.
So I didn't want to do that. I was afraid of that. For some reason, I was more afraid of going to sleep and not knowing what was going to happen than I would have been if they just said, okay, you're going to die tomorrow or something. It was that not knowing that it was very scary to me. And, I'm sure to anyone who's been in that position, but, I had the disadvantage of knowing what the mortality rate was. So that was bad. And really throughout the whole recovery period, you try to be hopeful, but when things don't seem to be improving, you get down, you get a little depressed and such. I don't think I ever lost faith entirely, but I felt bad. I mean, I was disappointed more than once throughout this ordeal.
Yes.
But I fortunately had a lot of friends and family who were concerned and who sent me wishes and prayers and little gifts and what have you throughout the whole thing.
Yes.
I even had people texting me every day while I was in the CCU, and I almost felt like, first of all, I didn't have any energy to text back, but I almost felt like saying, would you quit texting me every day? I'm in the freaking critical care unit. Give me a break here. But they meant well, and I appreciate their concern and their thinking of me.
And that was their only way of connecting with you.
And I really appreciate that they thought of me in several cases every day.
Yes.
Because they would text me every day, how you doing?
Yes.
Any improvement?
Well,
or that kind of
you
thing.
said something that really has been a very, very heavy conversation, not only as of late, but the mental aspect of this entire process has just been probably harder on people who cannot see their family, as well as the recovery aspect. And so you have firsthand experience being there, not being able to reach out to people who love you. And so what an advantage to at least even have the texting, even though it was annoying at times.
It is. And I should have said something about that, because the other thing is being alone in the room without the people you love that you normally see and depend on is terrible. And I will say that the nursing staff was wonderful. They did everything they could to make me feel better or to, lift my spirits or whatever.
Yes.
But there's no substitute for your family.
That's right.
And although I FaceTimed my wife pretty well every day at least, when I could, uh, there's no substitute for being there. So, and again, I have to speak. I speak very highly of the nursing staff. I had a problem with my nutrition because, as you probably heard, you lose your taste, and so you don't have the energy to eat. And when you try to eat, it feels like you're eating cardboard, and so you don't eat.
Right.
And so you start losing weight, and that makes you actually weaker.
Yes.
What we call protein metabolism starts to fall off, and so, excuse me. But your protein metabolism starts to fall off, and you need that to help recover. And so the nurses were wonderful. I mean, first of all, the community was wonderful in that they donated food for the nursing staff, and the nursing staff shared it with me. So I got food from some of the best restaurants around, which helped a great deal.
I'm sure.
It made you want to eat and kind of be able to eat. So that was a bright spot there, I think.
Well, I have to say, I love your experience just because you have two sides to it, as a patient, but also a doctor. And I know that you probably can debunk some myths that nurses are really at the top of the list when it comes to being important in a hospital, because many people depend on a doctor, but could you really be the best you are without a nurse?
No, I tell you, I tell them all the time, you guys, the nurses, you're my eyes and ears. I depend on you because I can't be everywhere at once. I can be taking care of one patient, but I have 20 patients or 30 or 100 or whatever it is. And I depend on all of you to make sure everything's going well and tell me what I need to know and direct me where I need to go. So as a physician, they do that. So as a from a physician side, we absolutely need them, and they do a huge amount of work keeping us on track as physicians. As a patient, in all honesty, they're the ones who care for you. And I say care meaning care.
Hands-on.
Hands-on. They care. Well, they care about you. They make you feel like somebody cares about you. The doctors are great for, they know what medicine to give you or what surgery to do. But it's the nurses who really provide that feeling of care for you. And that was very important to me as a patient. And look, I haven't been a patient since, forever, since I was like 5 years old. So I don't have any experience, particularly as a patient up to now. But I can see that's incredibly important. It can make or break your hospital stay, believe me.
Oh my goodness. Well, the stories are endless that we've heard across the country, in New Orleans, in Louisiana, around the world, of just the difference that nurses have made. The people on the front line, they have gotten all the attention and deserve so much more because of the effort that no one knows on the outside about what it's like. I mean, literally it's been compared to being in a MASH unit because it was so intense in the beginning, and so thankfully things have come to some maybe leveling off. Well, maybe because we have this uptick going on now.
Well, I know.
What's your thought about that? Because you've been, on the other side.
Interestingly, I was just communicating with our state health officer today about this, and one of the things that's confusing is when you watch television or listen to the news, you hear about, the new cases, the new cases, the new cases. To be honest, that's a totally meaningless thing. What you want to look at is hospitalizations and ICU use, and you could look at deaths too. I mean, and what you see is that hospitalizations were very, very high they peaked around late April. They peaked around late April. And now it's way, 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 way lower. But it's starting to trend up again. So the last week or so, in Louisiana I'm talking about, the hospitalization rate is going up. But the ICU rate is not going up, and the death rate's not going up. So what we're seeing younger people who have it, but not quite as bad. Bad enough to be in the hospital, but not to where, oh my gosh, they're going to need a ventilator or they're going to die or something
And
like
so
that.
these people would be considered like the carriers, or they were at home and just
Correct.
weren't around anyone, and all of a sudden with the release
Correct.
of everything.
Exactly. And so there are people who have apparently no symptoms at all, and yet they can still be somewhat contagious. We're not really sure.
Yeah.
Because the initial thought was, well, to be contagious, you have to, cough or breathe out germs. So if you're not coughing, you're not going to shoot out a bunch of germs. You might do a little when you're breathing, but if you don't have a cough or sneezing, you probably don't have enough virus, to cause those symptoms. So you probably don't have enough to breathe out much anyway. So that's the thought, but we don't know. But the other issue that we have with numbers is that most of the statistics that are gathered in Louisiana and in other states are positive tests. Okay, I can tell you in my ordeal, I had 7 tests.
Really?
Right. 3 were negative, 4 were positive. So technically, I was counted 4 times.
Wow.
Now, in Louisiana at least, and I can't speak for other states, there are state epidemiologists who try to go through all those tests and match up names or some identifier, so they're not double or triple or quadruple counting people. But even they admit we can't. That's a manual process, and so we can't be sure. If we're doing that. And in fact, the state health officer just told me there were over 380,000 tests done in June alone in Louisiana. And so you can imagine what a huge job that would be to try to match up every one. So when you hear a news report that says, oh, there's X number of new cases, really you don't know, are those cases of people who have minimal to no symptoms, or are they cases that, like me, might have been counted 4 times, and it's really 1 case, not 4 cases.
Really good point.
And the average person who is positive typically has more than 1 test, sometimes 2, but often we're finding people with 4 seems to be a good number. And it really, because if you're positive, usually they want to do a confirmatory test. Okay, you're positive. Then you're going to get a test to see if when you're negative, and if you happen to be not negative yet, that's another positive.
Test. That is a great point. And do you have to be tested negative twice to be released, or what?
Well, you do. A lot of policies for employment and mostly for employment because school's out, require you to have 2 consecutive negative tests before you can be considered negative. Like for instance, when I got home, I was still positive. The test I had on my day of discharge was still positive. So I had to come back. I came back in a week or so, and I had a negative test. I went, okay, great. And I thought, and everyone thought, oh, he's going to recover quickly. He'll be back at work in no time. So they said, okay, you got to quick get another negative test. You got to get it. And so, I waited and I got another test, and it was positive.
Oh my goodness.
Oh no. So, I had to get 2 more negative tests. So
in what span of time?
Well,
for the consecutive.
Well, interesting. It doesn't matter if you have 2 consecutive tests.
Okay.
Like if you have 1 test, it's negative, and you have another test 3 weeks later, it's negative. Then you're considered negative. If you have 1 test, when I first got discharged, our idea was we'll have a test on 2 days, one after the other. Well, the first one was negative, the second one was positive, so that's no good. So, okay, we'll wait a week.
Right.
So we wait a week, and that was positive again.
Oh my goodness.
Well, we'll wait another week. So another week, okay, it's negative, and then another week it was positive. Although I think I waited about 10 days because I was still getting
better.
At that time I wasn't. In that early period, the first 6 weeks or so when I got out of the hospital, I really wasn't getting better. But so, I didn't really feel like coming back in for another test. So I kind of fudged and delayed it about 10 days, but then it was negative. So I was no longer contagious or infected, but I still had the lung issues where I couldn't breathe very well.
Right. Well, I've seen so many different people with different, outcomes, not including death, but those that have just become so weakened that they've needed therapy. I've seen people
Right.
whose limbs just looked lifeless and they were still
Right.
released, obviously because probably the bed was needed. But,
Right.
what does that mean when someone is in need of the physical therapy afterwards? I mean, it just seems like such an aggressive attack on
It
the
is.
body.
It is. Well, first of all, just being in the hospital for
Yeah.
10 days, 2 weeks is going to make your muscles weaken and get kind of what we call atrophied.
Mm-hmm.
So it's not uncommon, even before the COVID thing, that people who are in the hospital for that period of time, you would have to send them to either, if they were not too bad, you can send them home with physical therapy.
Mm-hmm.
People would come to the house and exercise them, once or twice a day. Or you'd send them to a skilled nursing facility
Mm-hmm.
where the physical therapist would work on them. If they were really, really debilitated, you'd send them to a rehab unit, or a rehab hospital where essentially it's a hospital setting, but
Mm-hmm.
they do a
Focus
lot of
on that.
rehab. Yeah, they do a lot
Mm-hmm.
of physical rehab. In my case, I did experience that, but I went home and I had some dumbbells and barbells, and I thought, well, I can manage this on my own. I don't need a physical therapist. So, but yeah, you have to do that because you're very, very weak. Um, Everything is like an effort to do. I mean, I'm still not 100%. I have a little bag I carry
Yeah, we'll show
stuff,
everybody.
and yeah, I have this little bag, and
Yeah.
I can't do that. My arm
Okay.
is not strong enough to hold the bag,
Wow.
and so I have to kind of do it a little bit and get in and
Gingerly.
do it
Yeah.
a little more.
Mm-hmm.
So I'm still not 100%, but it's
Better
obviously
than you
much
were.
much. Oh yeah, much
My
much better.
goodness.
And it
Mhm.
and I'm 2 months out, so
Wow.
it obviously is a long-term thing. It takes a while
Yes.
to get better, and it really depends on what kind of shape you're in before you
Yes.
went in. Now I wasn't an athlete or anything, but I
Yes.
was reasonably functional.
Mm-hmm.
But people who get
Have the
it,
underlying
who have
issues.
underlying issues, who
Mm-hmm.
maybe have are debilitated for other reasons,
Yes.
they're going to have a very,
Yes.
very long recovery, I would suspect, and
Yes.
that's what we're seeing.
Right.
Um, so yeah, there's a lot of that. The muscles are just, in fact, I held up my arm and kind of and looked and said, oh my God, I have like old, no offense to any grandmas, but old grandma arms, that kind of shake. And I
Women
went,
can relate to
oh
that.
my goodness. But I thought, oh gosh, where did that come from?
Yeah. Well,
So
I tell you, Dr. Chugden, you have really informed me and all of our listeners and those watching with so much valuable information. But let me ask you a question that only you can answer. How
okay.
have you changed from the doctor you were before COVID-19 to today?
I'll be honest with you. I appreciate nurses more, and if you'd asked me before, I would have said I was one of the doctors who actually thought more highly of nurses than average doctors,
Hmm.
and I think that's true. But now even more so. So there's that. I think that the it's I still haven't really processed this part, and I'll just say there are people talking about these COVID survivors are all subject to PTSD and such like that.
Hmm.
I really haven't felt any signs or symptoms of that,
Hmm.
but the truth of the matter is that it is it makes you look at your life and your surroundings differently just when you realistically confront the possibility that you're not going to be here tomorrow, or you're not going to you're not going to ever wake up or whatever.
Hmm.
It's one thing to say, oh, I've thought about that, but you realistically face it. And it happens in a lot of situations. It happens in lots of illnesses. It happens
Hmm.
in you know violence situations, whether it
Sure.
be war or a crime where you're faced with, oh my God, I might be killed.
Hmm.
um, but it makes you reevaluate, I guess, the value of what you're doing with your life.
Yes.
And so I definitely feel that,
Hmm.
definitely. Um, so I hope it makes me a better person. I really do. Um, I think so far it has. It's made me a more grateful person, although, truth be told, very few people have experienced it so far because I've been home with pretty much no visitors or anything
I was going
for
to
the
ask
longest time.
that. So
Well,
when you went home, were there other family members? I know
well,
you.
I right now all my kids are grown up and
Hmm.
gone, so it's just my wife and I,
Hmm.
and she's been wonderful. She's taken care of me like a champ the whole time.
And you said she was a nurse.
She's a nurse. Strangely, she has not ever gotten. She's not been COVID positive, and even had the antibody test, which they read as saying, "Oh, you haven't even been exposed to it." And she said, "Are you crazy?" She was with me for a week before I went in the hospital, and
Right.
then I came home positive. Now we tried to keep socially distanced
Sure.
and slept in separate rooms and that sort of stuff.
Hmm.
But still, we're in the same household.
Hmm.
Um, my kids, we had most of the neighbors, friends, and kids um, have kind of kept distant just because of the whole kind of social distancing, because they don't
Yeah,
know if they're
absolutely.
sick. Not that they want to get it from me, but to be honest, we're not even sure if you can catch it again. If you
Hmm.
can, and I had such a tough
Yeah,
time the first time, they don't want it to be
right.
worse the second time.
And
So
is that where the antibody tests come into
it
play?
does, but the question with the antibodies apparently seem to work because I got plasma transfusions with
Hmm.
antibodies and they work.
Hmm.
The question is, how long do they last? So, I'll get antibody tests for months to come and see. And it may be that I have antibodies for the first few months and then, next month I don't. I
Hmm.
don't know.
Hmm.
Uh, Supposedly there are cases of people who have gotten it twice. So the fear is that, well, maybe your antibodies go away after a while.
Hmm.
There's a, and I'm certainly not a scientist, but there's a concept in immunology called an amnestic response, which means if you get something once, your body produces antibodies, and then the antibodies may fade away. But if you get it again, your body knows how to make them, so it makes them real quickly and in big numbers. That's in fact how people get anaphylaxis, like a bee sting.
Hmm.
Your first bee sting, you react to it. It's the second one that kills you, where you get this overwhelming
Wow.
response. So there may be an amnestic response to this. Not, that would be dangerous, probably be good.
Hmm.
That maybe the antibodies do go away, but if you get it again, your body will produce, a gazillion antibodies, and you'll just have a mild case instead of
Hmm.
a bad case. Um, the best situation would be if it's like some other viral diseases like smallpox,
Hmm.
polio, where you get antibodies and they just kind of stay with you forever and you
Hmm.
never get it again, or
They're just
mumps.
ready
And
and waiting.
yeah, they're just ready and
And that's
waiting.
the
And
idea behind the flu discussion.
right, right,
That was so much of the talk in the beginning, that this was similar to flu,
right.
because, and I think the thought now is hopefully in the coming months or the coming year or the season, that this would be similar to the flu, that if it did come back,
Yeah.
hopefully it wouldn't be something
Well,
that couldn't be controlled.
yeah, that's true. Although the problem with the flu is there's different mutations of the flu, and that's why there's a flu shot every year.
Yeah.
And the problem with the flu shot every year is they base the flu shot on stuff that they see in the Far East, China and
Hmm.
Thailand and all this,
Hmm.
and they think, okay, well that's going to migrate toward the Europe and the United States, so they
Hmm.
make a flu vaccine based
Hmm.
on that. Sometimes they're wrong, and that's when you hear these things. Oh, the flu shot didn't work that year, and sometimes they're right, and then it works pretty well, and
Hmm.
but that's why they have to make a new one every year. So if this coronaviruses apparently don't mutate as much as influenza viruses. So the hope is if they make a vaccine for this, it'll stay good for a while, or if it does mutate, it'll be
Hmm.
just a little one and it'll still work. So,
Well, that would be great.
it would be
Well,
great.
I have to say thank you again, because you have given us your time and you shared so much personal insight on this experience. And so, what is your optimistic look for the city, for people? Should we continue wearing masks? I mean, I know that everybody still doesn't have all of the answers, but
Yeah,
are we headed in the right direction with the distancing and?
I think so. I mean, I think as long as we have evidence that it's prevalent in the area, which we do because we have tests that show it, and we have hospitalizations that show it. As long as we have that, I think mask wearing is a good idea. And what people have to remember is that you wear a mask not for you. It doesn't protect you, it protects everyone else. And for people who say, oh, a mask doesn't do any good, I read some study or whatever, almost always they read a study that says a mask won't protect you from breathing in something. That's true, it won't, unless it's an N95 mask, which filters, most stuff. The high filtration masks do protect you, no question. These kind of masks, like we have now,
Yes.
no, these don't protect you. They protect other people from you. And if you don't believe that, think about why about 100 years ago did people in surgery start wearing these. It's so they didn't breathe germs into people's bodies while they were cutting on them.
Yeah.
So they work.
Yes.
They actually work. And so they do prevent you from spreading germs. Do they prevent 100%? No, but they prevent you from spreading germs. If I put this on and I cough, yes, some air is going to escape out here and out the sides, but the bulk of it is going to go straight in here, and it's going to filter out any little particles of
and it won't
saliva
make it 6 feet.
or whatever, and it won't make it 6 feet. And so it does help. There have been, oddly, years ago, probably 20 years, my 34-year-old son, when he was in junior high, that's how long ago it is, did a science project where they got during flu season, where they got kids to wear masks. They asked kids to wear masks to school for, I think it was a month or 6 weeks. And they said, okay, we want you to wear masks to school. And then they took one group of the kids and they said, we're going to incentivize you by making masks with colorful logos and designs on them that were popular at the time, like,
we see it today.
Pokemons or whatever they were. But at any rate, things that were appealing to the kids. So they found out two things. One, the masks that were appealing to the kids were more popular and were worn more. The masks that weren't were not. But then when they looked at the absenteeism over the next month or so of the kids due to illness, which was the flu, it was way, way lower in the group that wore masks. Way, way. So
evidence.
That gives you some evidence that it probably helps. The Japanese have been doing it for a long time in crowded areas, and they really haven't seen the spread of diseases like coronavirus, for that matter, the pandemic type spread within their country and their cities that we see in other areas. And one of the reasons, I believe, is because they have a culture that believes in protecting others, that they have a duty to their community. And so I would say wear a mask. You protect other people by wearing a mask, not yourself.
And definitely wash your hands.
And wash your hands,
oh,
of
my
course.
Goodness.
Absolutely.
Yes.
You wash your hands, wear a mask, keep 6 feet away from people so that you're not breathing down their neck, and you will minimize the spread of the disease. Will you stop it? No. But you will minimize the spread of the disease. I think we're going to get through this. Unfortunately, I think it's going to take a while, because it's really going to take it. That sounds stupid, but you really kind of want it to spread more, because once you can get...
Is that the herd immunity?
It is. It's a herd immunity concept that if you have 100 people and 90 of them already have the disease, then the disease can't jump anymore. It's got to jump 25 times to find those 10 that haven't had the disease. And if you have immunity for a significant period afterwards, it doesn't have to be for life, but even if it's a few months, that might be enough to stop the spread, because if you get enough people who have it in that few months and then they're all over it and they're all immune, it's going to have nowhere to go. And so it's a difficult situation, and I'm I might have been inclined before I got sick to say, oh, just let everybody get it, and the 1% that are going to die, they probably would have died anyway. But now that I've had it, I realize, wait a minute, I don't want to be one of those guys. You realize, geez, this is really a bad illness, and I don't want to get it. I don't want anybody else to get it.
Right. Every life matters.
And every life matters, right. I don't want this to spread through my community or any community, because there's going to be a lot of people who are going to die
Yes.
from it if it's becomes really widespread.
Yeah.
That said, though, sometimes if you could somehow let it spread through the healthy young population that were very unlikely to get sick, that would be an advantage. That would help. But how do you do that without spreading it to mom, dad, grandma, grandpa, or,
Yeah,
or
'cause
somebody who maybe not old but has
everybody's
some other
moving.
debilitating condition?
Sure. Well,
So
this has been
it's a
one
tough one.
history lesson for
Yeah.
us all. My goodness. Thankfully, it was 100 years before it happened again.
Yeah, I
And
hope
my
it's
goodness.
another 100
Yes.
or 200.
Yes.
Trying to
And
think of my grandchildren. Maybe.
well, you're a part of the reason why we will do better, because the medical community, scientists in particular, are working very hard to come up with
They
that
are doing that.
vaccine that
Good.
will answer a lot of all of that is confusing everybody. So I hope that your life continues to flourish and that you have many healthy days. And have you instituted other practices that you're going to continue since all of this?
Not necessarily. I mean, to be honest, I haven't done much because I'm
You're
still
just getting
sort of
back.
recovering. I'm just getting I
Yeah.
tell people, I'm just kind of getting my feet on the ground.
Yeah.
I'm going to be much more um, focused on preventing infection spread in my life and in this hospital than I was before. Now, I was before, but it's even more. It's
Like
personal
laser
now.
focus now.
It's personal now.
Yeah.
It really is.
Yeah.
And just before this, I was at meetings basically discussing some infections that we had and how we can prevent them from ever happening again, um, and what we need to do to make sure everybody's doing it so that we don't have these things. So there's certainly stuff we can prevent, and we need to prevent it. And like I said, I'm personally focused on it now. It's nothing makes a believer out of you like
Experience.
surviving some experience like that.
Yes.
Yes. Yes.
Well, we are absolutely thankful that you've survived, and we definitely are proud to call you one of the heroes, because you are
Yeah.
here to tell the story. We know that there are many heroes who go unnoticed and unrecognized, which is
There
why
are.
we are really thankful that many frontline recognition is happening throughout the hospitals, throughout all of the communities, and it's just necessary. And I think it really teaches a valuable lesson that everybody's important and everybody serves a purpose and a role, especially people at the store when you kind of didn't think they were, of maybe they were replaceable, but
I,
suddenly,
you really find out when suddenly something's not there anymore.
yes,
And
that
you go, oh
people are
my
important.
goodness.
Yeah, everyone, we have been given great information and spent some great time with Dr. Chugden, and we're so glad that he still remains the Chief Medical Officer at West Jefferson Medical Hospital. And I know that everyone is thrilled to have you back, and we're just happy to be a part of that welcome back process. And we just know that better days are coming, especially with everybody being reinvigorated and about making everybody healthier and better. So, once again, thank you for stopping by the Focus Podcast, and we have spotlighted a great doctor. And until next time, stay focused.
Thank you.